So I've been asked to talk about scars and reconstruction. So I'm a plastic surgery consultant based in Bristol, as well as we work in Bristol slightly different. So it's not just dermatology that does the initial diagnosis. That happens with us in Bristol as well. And I don't think there's any of my patients actually in the audience, so I can lie and say all my scars are fantastic. So a quick outline, we'll quickly talk about skin. Look, there's loads of science on wound healing and all the rest of it, which you don't probably really need. What we're here to talk about is how we can maximise how your skin can heal the best. And if you have any problems, what we can do, or any issues that we can, or any treatments that we can give, which will help your scars become better, or as best as they possibly can. So we'll talk through that, abnormal wound healing, and obligatory pictures. I was told by Imogen that we need to have some nice, gory-ish type pictures. So I've got a couple of those. And essentially said there'll be questions at the outside. Quite simply, you've got the structure of the skin. You've got the epidermis at the top. Dermis is a nice thick bit. That's the springy bit. So when you pinch it and you flop it back, you've got nice young elastic dermis that is primed to heal quite well, and it's nice and strong. As you get older, your skin gets thinner, and you see the sort of, as you get older, you get those sort of paper-thin skin, and you can easily cut and graze yourself. You already, as you get older, start putting yourself towards potentially adverse wound healing. But on the flip side, when your skin's a bit floppier, actually sometimes you've got a bit more leeway to pull things around. So that can help with us when we're trying to perform the surgery. And that's all the sort of sweat glands, blood vessels, lymphatics are all hanging around in that bit of tissue. And that's important to note. So melanoma sitting in the dermis actually is one of these, it's such a bugger because it's got access to all the structures. That's why it can spread to all these areas. And that's where it's sat in there. Wound healing. There's an inflammatory process, there's a bit of proliferation remodeling. So what tends to happen is you get an injury. That's my knife, that's injuring your skin. The body goes, don't like this, and it sends lots of mediators into there. You get a blood clot forms. I try and put it together nicely. And then once you've done that, we've disrupted the columns of nice normal tissue, and then all the collagen and other bits trying to form together. So initially you get like a lumpy type of scar, you might think, or everything's a little bit pink and raised. It's this inflammatory reaction from what the body's trying to do, but sometimes also due to the suture materials that we use. It is a foreign body, whether it's dissolving or not dissolving. Your body will react to it a little bit. Some materials are more inert than others, and that is what happens. It proliferates, it's sort of a disorganized bird's nest is what happens, and then slowly over, it can be up to 2 years for a scar to properly mature. You want all the fibres to align so it will form as good a scar as possible, and that's what we call the remodelling process that goes there. Now this is this is a relatively early normal scar, so you can see a bit around the edges. It's a little bit pink. This is about 1 or 2 weeks after surgery. This has had all dissolving stitches, which is why you're not seeing anything on the outside. And it should progress, and some of these pictures are going to be different between different patients. It should progress to something like this. So that's around about 4-6 weeks. As you can see, the redness has started to go. It's forming a nice sort of thin line that's through into there. At that point, it's a little bit lumpy, and that's the time when we can start doing massage and things. So you'll get lots of people talk about bio oil and all the rest of it. Yeah, well, we'll talk about that just in a little bit. Sometimes we get things that are a little bit too big to close directly. So he's got a big lump on there. It's not the dark ones, it's the lumpy bit by his hairline. And then we might need to borrow skin from somewhere else. So we take a bit of skin from his neck, and so you've got that nice little circle, which I probably should have taken that for you for the point, shouldn't I? Yeah, there we go. So there we go. That's the skin graft. So we've just taken a bit of skin. So that was that whole dermis from his neck, and then we popped it on top of there. It's gone. That one's actually worked for me. So I think everyone's quite happy. Now, I do get post-op complications. This lady had something on her temple, and I had to get a few bits and flip them round to try and fill the defects, because I thought it would be a better result rather than leaving a sort of big sort of, like those old gold coins you get in your stockings at Christmas. She would have a big hole in there. So I thought we'll flip things around. Lots of bruising. She had a bit of an infection. Eyes went a bit puffy. Looked like she'd been in a ring, not with Anthony Joshua because he got smashed about, but probably someone like Mike Tyson and the rest of it. But yeah, as you can see, it goes on a little bit, still a little bit bleedy. The swelling and things are coming down there. And then eventually, about 2 years down the line, it's like, hey, presto. Can you see a scar at all? Well, yeah, she's got her little Harry Potter, as I like to call it, and it's just sitting through into there. And off she is with Professor McGonagall in Hogwarts. So, yeah. Right. Abnormal wound healing, that's what we want to talk about, when it's all gone a bit wrong. And it's at this point I like to say it's probably not my fault, it's all patient factors as to why these things have gone wrong, but no, it probably is my fault. So this is an interesting one. So you see here, these have got sort of stitch marks. So this is all part of the process. When we're using things that are sort of biodegradable materials or permanent materials, it's a balance. So some of you might have that thin scar we showed at the start, or some of you might have a scar like this with little bits either side. Now, because you've had suture material in the skin, as we're breaking it and it's going to form a scar, that's why you get those. You can say it's an unattractive scar, and it depends where it is in the body, and it bothers people more than others. But there may be a decent reason. So sometimes I have something where, you know what, it's a relatively tight closure. I just need to hold the skin together for as long as possible while it heals. Your scar is only at about 50% of its eventual strength at 2 weeks, so you might want to hold it a bit longer. Adverse things happens, you can have a scarring thing. But with me, I talk to the patient, I say, well, look, what do you want? We can try this way, you can try that way. It might be preferable to have these marks as opposed to having a wound that breaks down, becomes open, you have to go back for many dressings and all those sort of things. So it's adverse, but it's not sort of abnormal. Stretch scar, so as you can see here, the wounds have just sort of moved over. Now, if you remember, what essentially we've done is when you've chopped a bit out of someone, you've made a discontinuity in the skin. You then try and bring it back together, and you're trying to hold it for as long as possible with your stitches or whatever materials to try and make it stay and knit a scar. But unfortunately, it wants to go back to where it came. So with a stretch scar, you get this thing where it just starts to breaking away. It's the same thing with stretch marks when you have pregnancy, or if you're like me, you eat a few too many pies, or go to conferences and have loads of cake, so I come back with another couple. But the skin just stretches, and it stretches beyond its capability of that nice dermis just holding together. It's almost like a crack. Here we go. So my man who plays cricket at the back, it's like when you get your dry wicket, so and it really dries and bakes, the ground breaks, and then it forms cracks. That's what it's sort of done. It's a discontinuity, and that's why you get this sort of stretch scar. There are things we can do about that, which I'll talk about later. That's just another example that you can find there. Then we get into this hypertrophic versus keloid scar. Now, the person, and it won't be me, I'm not clever enough, that invents a cure for hypertrophic and keloid scars, never happens, will be a gazillionaire. So what happens on this, there is probably low-grade infection, lots of inflammation, all these processes that we talked about briefly that were normal. There has been a disorder in the process for whatever reason. It could be my poor technique, that's not put things together, I've not put the edges right. There could be patient factors. Maybe there is some bacteria hanging around the skin. Maybe you've got other things going on or other conditions, because despite this all being about melanoma, you are allowed to have other diseases and other things that can affect things that are going on. When you put all this soup together and it just doesn't quite go right, it starts getting a bit red and angry like this. And the other thing we move toward is like a keloid scar. Has that come out all right? Keloid scar, it starts going outside its boundaries. Keloid is when it's lumpy, it's red, it's itchy, it's angry, it's all these sort of things, and it's not great. Now, the keloid scar has got a sort of irregularity. So this is on someone's shoulder, it's me looking down. Or if it's a tight closure, bony prominence, it's going to happen. Sternum, so in Caucasian or white skin, sternum, classic area. Here, classic area. Behind the ears, classic area. If you've got skin colour more like mine or darker than me, actually you can just keloid any way you want. But there'll be something within there. It just happens. And when you see people with tribal scarring, they're deliberately doing it to get keloids, and that's what it's about. So we all know Seal, brilliant, Kiss and Rose, one of the best songs ever. His is all related to tribal scarring and all those sort of things. So yes, some people find it an advantage, but obviously it's not necessarily an advantage for lots of people, especially if they're symptomatic, and that can be the issue there. So scar treatments, massage. This is when you come down to this great debate, and they try and hammer you for your money for things like bio-oil and whatever you want to call it. So, I'm a massive believer in that most of the process of it is you need to keep the skin hydrated. So I don't think you need to spend a fortune on the scars. You know, everyone should be moisturising their skin. I do. I like cocoa butter. It's quite nice on my skin. But even something simple like E45, which is a light moisturiser, that provides a slip medium. And it's actually the mechanical nature of you looking to try and break down the scar tissue. That's what you want to do. That will help your scar get better. Now, most people have probably got some form of scar here, and as we hear the stats that you may have another scar in the future for whatever reason. But certainly when it's at a time when it's healed, massage it. And like I said, simple moisturiser is fine. There's no issues. Silicone and gel sheets, we look at these for things like keloid scars, and what that does is that helps it basically hydrate a bit more, puts a few little bits and bobs in there, and it helps the system to try and reorganise itself, as well as massaging and laying sheets on. Steroid injection. So when we saw the keloid and the hypertrophic scar, something's gone wrong, and the inflammatory reaction is just whizzing around it's like when you give your kids loads of E numbers. It just doesn't want to behave. It just starts running around and just doing stuff it shouldn't do. That's what's going on in a keloid scar. It's massively disorganized. So you can give them a steroid injection. Essentially, it's like I used to have it. Probably that's what affected me. But you put a bit of whiskey in the milk or whatever when I was breastfeeding to help me try and go to sleep. That's what you sort of do with a steroid injection. You're trying to calm down the inflammation and let it just settle. That's got a lifestyle. You can't do too many of them because that thins the other skin around it as well. So you're trying to hit it in the keloid and not any other tissues. Laser's really cool, not just on the pointers. So what laser does is you've got different type of things you can use. So you can use laser for the redness, because what a laser does is it attacks a certain wavelength light that the stuff in there will respond to, and you're looking to obliterate things like the vessels. And I've got an example of what we've been through with that. But also, if you've got the stretch scar, you can use something like a CO2 laser, and essentially that puts these nice little cutting cones. It'd be really cool if it came in a lightsaber, but it puts some cones in there. You create an injury, but by doing that, oh hello, oh God, what have I done there? Oh no! Oh, sorry, I'm on the computer. Sorry. Something came on the screen here. Sorry. But what you do is, if you create an injury, then it regenerates. So, if you remember back in the time when HDTV came in, a lot of people, I think it was Kate was one of the newsreaders. A lot of people, you didn't see them for ages. They all had laser resurfacing because everyone saw their blemishes, but then they all had a massive reaction. But then they came out looking really young 3 months later. So that's essentially what they were doing. Radiotherapy, that's for alongside keloid scars. So you get obviously ear piercing is a big thing. You can use radiotherapy for these. Try not to give radiotherapy if you don't need to. It's sort of quite far down the line. You're doing many, many, many ones. But it's there. And pressure garments. So you have one after ear piercing. Take it out. Put a clip on it. And that pressure just sort of, you're just looking to strangle it and to stop it from misbehaving. And then surgery. Yep, you can cut them out and give yourself another scar. And hopefully it'll be a bit better. But you can add other things in there to try and help it work. So if you have ones on your forehead lines, sometimes you put a bit of Botox in there because it stops your forehead lines, your muscles working so the scar can stay together again. Makes you look younger for a little while as well, and let the scar go, I think. So there's all kind of things that we can do. People look to insulin and stuff for throwing to the scars. So I'm not doing that, I'm doing this way, aren't I? Yeah, so we talk about laser. So this is a young lady of mine. So she initially had, it was actually a cardiac, a pacemaker inserted. She reacted really bad to the dressings. That's her wound. Didn't go well, and eventually she ends up with this. So she's got just a horrible stretch scar. She didn't really like. It's on the chest. It's right here, young lady. You're allowed to wear appropriate wear. So what we did, I thought was really clever. And so I took it out and I closed it, and I used about 45 million layers of dissolving stuff in there to try and really hold it together, taped it, splintered it. But slowly over time, you start seeing that it's spread out again. It doesn't project that well, but it's spreading out here. You can start to see some vessels and patches that's around there. So with her, we're going through a course of laser. That's sort of after one go, you're starting to get rid of these little red parts there. And then again, this bit here doesn't project too well, but the red bits are slowly going. So we can't do too much. She's stretched. It's in an area of movement. She's exercising things, but we can get rid of that and the symptomology. And also she became a bit raised, so she had a bit of steroids. So she's had a bit of both. And then what we might do after the redness is gone is do a bit of CO2 and shrink it down. So there are options to, if you have a problematic scar, to use there. Reconstruction. You said I got to do this one, didn't I? Yeah. That's a wink. Oh, yeah, okay. So I had this lady, and that's a nightmare, but she's lovely. So I have to put this on because I'm quite proud of myself, because that's the record for the lab. So that was melanoma, unknown primary, and it's 3.5 kilo tumour. And so I've got the record in the lab for removing it. Nothing anywhere else. Took it out, and I was thinking, what am I going to do here? How's the skin going to heal? How to move stuff around? And we saw her on our clinic on Thursday. She's brilliant. She always brings me in pies or a Scotch eggs and cake she makes at home. Anyway, so with her, it was a combination of stuff. So that's part of the thing then to there. And I couldn't close the skin. So I had to do a skin graft. That's where I took the skin graft from, so that's how it healed pretty well. Little Sebke coming in the skin graft, but we thought was quite funny. But that is where it is, and it's all nice and soft. Everything's good. Very little lymphedema. So I've used a technique of moving some of the tissue around a little bit of a skin graft in there, and that's something that you can do. That's part of the reconstructive things that we've done. And she's disease-free, and not even needing any systemic therapy, which is really, really quite cool. This one, so this is going to be two different. You'll notice the next picture has got way less hair, but this is a typical kind of thing. If you've done a melanoma excision on the leg, you'll get a hole like this that you've got to sort out. There's all like gubbins and bits at the bottom. But what we can do is move some tissue locally. It's something called a Keystone flap. So, it was like this. This is the lady's legs. If you did a skin graft, they'll end up with a dip. So it's like someone's taken a sandwich, and Tiger Woods has just done that. And that's not really great for that sort of look. Moved a bit of tissue locally, and she's got quite a nice contour defect to be since there. Okay, she's got a bit of a scar like a Keystone, which is why it's called that. Again, I didn't invent it. I'm not clever enough, but I managed to get it right so it works for her. All right, so this one's going to jump through a few patients as well. So we have things like nasal defects, skin cancer on there, had to be removed. We wanted to make sure we got it, so we did it in a staged procedure. So the gentleman that you'll see had virtually exactly the same defect on his nose, but on the other nostril. I didn't have a picture of his original. So he had a defect like this. All right, so what we're going to do, he's got a hole in his nose. You can get one of those fake ones, like a Mr. Potato Head, and you can have those things, and you can put it on with glasses or have the fake bits. But he didn't want that. It can be hassle. It can fall off. Imagine you're seeing someone and it's a bit hot and sweaty and the prosthesis for it. It's just not great into your fish and chips on a Friday. So this gentleman had the same. So we put him through a process. So this bit here, I took a flap of skin from the top and it popped down, and I gave him a little elephant's trunk into there, and you leave it connected for about 3 or 4 weeks. Then I bring it back again, and you chop out the bit in the middle, and then you reposition it to cover the hole, and he looks like this. And he's gone. That's about 3 weeks after the line. I saw him a bit later. Look, it's still a little bit bulky around there, but he's like, you know what, I don't really bother. I'm happy with that one. You can revise it. But as you see, look, he has got scarring then. So scarring on the forehead, big hole in the nose. We have a chat. That's what he wants. And so you can do those sort of things. And fortunately for him, he was well bald. So he's got no... Because what you have to do when you bring this around, you've got to fold it on the inside of the nostril. So I had to take a bit of cartilage from his ear, fold it inside the nostril, cartilage in the ear, put it there, and then sandwich it to be able to create both linings. But that means you don't have to shave on the inside of his nostril. If they got hair, it's just a real... Because you get these little... It's almost like a barnacle, isn't it? You get these little bits that'll be popping out. But he's all right. He's quite happy.